Hello, Dr. Smith. Thank you for seeing me today.
Oh, it's a pleasure meeting you. Who is with you?
This is my cousin, Emily. Is it all right if she stays?
It's all right with me if she stays, as long as it's all right with you.
Sure.
And often I would ask people to leave when I do the physical exam and then have them come back, if that's okay with you also.
Sure.
Okay. So what brings you here today?
Yeah, I got your name from my health insurance company's website.
I actually have a few friends who see you and they speak very highly of you.
Thank you.
I moved here several weeks ago, and I went to the pharmacy to buy vitamins, and while I was there, I took my blood pressure on one of those machines, and it was pretty high. So I spoke to the pharmacist about it, and she said I needed to see my primary care doctor.
Do you remember what the number was when you took your blood pressure?
I have it written down. Let's see. It was 145/92.
Do you have any other symptoms that you have besides the blood pressure?
Not really, although I am prone to headaches.
Can you describe the headache for me?
I have it written down. Let's see. They're in the back of my head.
Do the headaches ever go on one side of your head versus another, or is it always in the back of your head?
They're just across the back of my head. If I could take some ibuprofen or a hot shower, that helps make them go away.
If I'm going to ask you a question so that we can categorize how bad they are.
Okay.
Between 0 and 10, 10 being the worst, how would you categorize the headache?
A 3 to a 5.
What else is going on? Anything?
No, not that I've noticed.
Do you take any medication that could affect blood pressure, do you think?
I do have a prescription here that I brought with me.
This is just for gastrointestinal reflux, so I don't think that would be a problem.
Okay.
Anything else that
I
you're
take
taking?
an allergy medicine that has a decongestant in it, and I take vitamin D supplements as well.
Now, sometimes the decongestants can cause you to have a higher blood pressure than normal. When did you take the blood pressure reading in relation to when you took your medication?
You were saying that your allergies were really acting up that week.
Oh, yes.
Okay.
And I was having some symptoms that week. So maybe.
Anybody in your family have high blood pressure?
Well, I do, and my mother had high blood pressure too. She actually died of a stroke.
Okay, so it is important for us to make sure that your blood pressure is well controlled. It really is unusual for me to be seeing you like this, but sometimes in my practice, we see people before we send them into the examining room. So, because I think it's nicer to talk to someone in their clothes rather than in a gown. But I'm going to go into the examining room with you. I'm going to ask you not to go into the examining room, as I said earlier, and then I'll get back with you when we come back. And that way we can see if anything shows up that is different from what you did. I may ask you more questions in the examining room. Is that okay?
Sure.
Okay.
Thank you so much for helping me to prepare for this and for coming with me today.
You're welcome.